We're actually going to take just a minute or two for April and Dustin to set up, and while they're doing that, I will verbal with them. April is a team leader with the community residential program with St.Amant, and she's been with St.Amant for 8 years. And I actually worked with April when I was part of staff scheduling, and worked very closely with her when she was part of several of the different teams that I worked with. And during that time, she started working with Dustin as a support worker. And Dustin is one of the individuals that is supported through the community residential program. And they're going to talk about Dustin and April's journey for the last few years.
Hi, my name is Dustin. I'm a 24-year-old transgender female to male. For 6 years, I've identified as male. And 4 years ago, I have started my sex change. And for 12 years, I have been receiving and still receive supports from St.Amant. Before I became Dustin, I was a girl named Victoria, who always cross-dressed in male clothes and had a mind of a boy, and had considered myself as a lesbian. There was just one thing that was not by Dustin's choice. That thing was being physically trapped in a female's body. At the age of 18, 19 years old, I started to call myself Vic and identified as male. And at the time, I had asked people in my life, my friends, family, and the staff at St.Amant to call me Vic and identify me as a male due to that being what I was comfortable with. Some people took this change well, while others struggled with it. But no matter whether the people in my life were part of the LGBTQ community or not, I still felt my wishes were respected to be called Vic and known as a male. As I entered my 20s, I made a call to the trans clinic to get professional help and an opinion I needed to get started on the path of a sex change. I was then put on a waiting list and told it could be a bit of a wait before I get in. In the meantime, St.Amant told me they would support me through my doctor appointments and surgeries, but at the same time, I had to keep in mind the loss I'd have of going down the path of a sex change. Those losses would mean the loss of my friends, family, and potential romantic relationships. On the other hand, with this path I would take would come some positive things such as new people in my life and an inner peace and happiness with myself when I would be identified as a man called Dustin. Sure enough, Clinic with the K called me back to set up my first appointment with the trans nurse and doctor. They told me I needed to see a psychologist to determine my mental and physical stability. At this time, I was told I had a gender identity disorder. I would also need a psychologist approval for the gender reassignment surgeries. I was required to receive 3 total psychological assessments due to my past history of suicide, suicidal thoughts, and attempts to ensure this was the path I still wanted. Though I understood why these assessments were necessary, this entire process was very frustrating. It was all as though the choice I was making about my life, my body, and my identity were being consistently challenged. I know who I am, I know how I feel, and I know what these surgeries would mean to me. Having someone questioning my identity made me feel judged and only served to feed my anger and anxiety and depression. Despite this difficult time, I pushed forward and finally got approval for all of my surgeries, as well as hormone therapy. I then began the physical process of my new life. On May 16th, 2013, in Winnipeg, I had my SRS top surgery. I had my breast removed and my chest was reshaped to resemble a male's chest. The recovery was quick, but there was a slight infection that had to be dealt with. There are visible scars with a lot of hard work will be hidden once I achieve a healthy and toned body, which we all know is easier said than done. On June 10th, 2013, I began my testosterone injections. This process meant I would have to inject every 2 weeks, which eventually changed to once a week. I get blood work done every 3 months, have a follow-up appointment with the doctor to make sure my testosterone levels are in a healthy place. In the beginning, I hated needles, but knowing this would be a lifelong task, I eventually started getting used to the needles and administering the injections myself at home. This hormone treatment has deepened my voice, helped me grow facial hair, and my moods are more stable. I also get more acne, which is gross. But thank God for proactive, right? The next step was having a hysterectomy. This surgery wouldn't be done in Winnipeg, and it would not be easy. Due to my age, doctors were less likely to give a hysterectomy. After my intentional assessment, I was told I needed a second opinion to be able to go forth with the surgery. Even after all my commitment and my choices and identity were still being challenged. After insisting we move forward and final approval, I was told the surgery would happen within a certain time frame. It didn't. I then was given another time frame, and yet it still did not happen. Eventually, with the help of my support staff, April Paulette, and her repeated calling and advocacy, I finally got a date for my surgery. On November 14th, 2014, I had my full hysterectomy, another amazing step towards truly becoming myself. This was a much longer and harder than I thought it would be. St.Amant was able to provide me with a recovery place, and April was there the whole time to cook, check my incisions, and keep me company. The next step was to get laser hair removal or electrolysis for the next set of SRS bottom surgeries, which requires a skin graft. The set of 3 surgeries to 4 surgeries can only be performed in Montreal. This means there would need to be a lot of travel planning, long distance calling, and a long process to get the right information to the hospital there. But with April's diligence, repeated calling, and consistent advocating, we finally got our first date to go to Montreal for a meet and greet with the doctor. On February 10th, 2014, April and I had our meet and greet. This doctor had to check that the skin donor was healthy and told me that I shouldn't be afraid to get mean and lean. To prevent complications, I would need to hit the gym hard. Shapes, here we come. In Montreal, April and I got the first date for my final step of my transition. On June 14th, 2016, I will begin the first of 3 to 4 surgeries that will fully transition me into a male. It is one of the most exciting times of my life. I finally feel as though I will accomplish something very powerful. It is an amazing achievement that will affect my emotional well-being and positively affect all of my relationships. I will finally feel comfortable in my own skin. There still is a long way to go. April and I are working towards fundraising to support of all the high cost of these final transitioning surgeries. With travel, new medication, laser hair removal, and recovery costs, I will need a lot of support, care, and strength to move forward. I have confidence that we will be able to raise the funds we need to finally see the end of this journey. I was once a woman named Vicky. Page is missing. Trapped inside a woman's body, and now I'm Dustin.
Hello, I'm April. I am a queer advocate and activist, and I've been a support worker for Dustin for over 2 years now. Before I even go into my speech, I wanted to point out, earlier when Jennifer was talking, she was talking about how the list of definitions that she had given are just an idea of what definitions are, but people often don't exactly identify in those things. And this was a prime example because I didn't go 1 through 14. I was skipping around, and when I read one of them, I was like, that's Dustin. And Dustin identifies as transgender, and we got that one wrong because that's how Dustin identifies as transgender, and that was the definition that fit him. Meanwhile, that one turns out was transsexual. So that just goes to show that people often won't always fit into these little boxes, and it's really important that you ask people what they prefer to be called. So anyway, thank you for the opportunity to speak to something I feel passionately about. Starting and continuing conversations about how best to support those around us that are lesbian, gay, bisexual, transgender, two-spirit, and genderqueer. Additionally, all of our queer allies out there that need our support as well. I worked as a direct care support worker for most of my adult life. I'm now in my 8th year with St.Amant. I've been privileged in my job to have worked with a wide variety of individuals that have taught me so much about them, myself, and how we can better support everyone around us. This is Dustin's first trip of his life, and this is when we first went to Montreal for his very first appointment. This was last year, or this year.
February. Yeah.
February of this year, right? Dustin, for example, has been so patient with those who mistakenly refer to him with the wrong pronouns or by his old name. He also continues to be his strongest advocate and reminds me of how important it is to express one's needs. Dustin doesn't always know this, but he constantly reminds me that I'm doing work that I should be doing. As everyone, Dustin and I have our difficult times, but the reward I experience working with Dustin is something I get to experience daily, and it's so very important and intrinsic to the work that I do, and to be a good support for him. As I said, I'm privileged in my work and consider it an honor to be a part of Dustin's life, as well as many others, and I continue to learn to be the best support for their needs. However, I see the impact in those that I support that exist under this umbrella and how they feel about their sex and sexual orientation in comparison to the larger majority of heteronormative society. I've experienced family members talk to me on the side about trying to encourage their children to choose what they deem a more appropriate lifestyle. I've seen blatant disrespect towards the sex and sexual orientation of individuals I support. They've been given Bibles. They've been asked, "Are you sure you're gay?" as if somehow having a disability or being in care makes them any less able to understand their own needs, wants, and desires. Human rights are not a hierarchy. The freedom of one person to believe what they choose should not exist at the expense of someone else's right to feel safe and represented. Everyone deserves to be in healthy relationships free from violence and abuse. Homophobia and transphobia is abusive. Homophobia is defined as a range of negative attitudes and feelings towards homosexuality or people who are identified or perceived as being lesbian, gay, bisexual, or transgender. It can be expressed as antipathy, contempt, prejudice, aversion, or hatred. It may be based on irrational fear and is sometimes related to religious beliefs. As support workers, expressing any of these feelings while working with the people we support is abusive, and it manifests itself in many ways. So what's the issue? LGBTQ individuals are at a greater risk for depression, anxiety, suicidal behavior, and eating disorders. They are 2 times as likely to smoke and have a greater lifetime use of recreational drugs. Additionally, they are at a higher risk for multiple cancers. For example, in biological females, breast and cervical cancer rates increase due to not accessing health care. Homo, bi, and transphobia and heterosexism experienced by queer individuals, both in the past and present, make them very distrustful and mistrustful of healthcare providers and systems, and results in the avoidance or complete delay of seeking medical attention, which leads to higher risks of many diseases due to getting fewer checkups and testing. The St.Amant website states that such support workers should optimize dignity, self-determination, and attainment of personal outcomes. They should maximize environmental and lifestyle features desired by the person, and should incorporate a high quality of support and treatment. So, the benefits of coming out for their health. If we as the support workers are able to put aside our religious, personal, and sexual beliefs and create a safe space for people that exist in this minority, we will begin to see improved self-esteem, self-acceptance, and self-affirmation. There will be a reduced risk of physical and mental health problems, substance abuse, addictions, suicide, and engagement in high-risk behaviors. The people we support will be able to build relationships built on honesty, which increases the likelihood of finding friends, community, and a sense of belonging. And quite importantly for us as healthcare providers, we will see an increase in personal advocacy for adapted treatment, a demand to have needs met, and an appropriate and timely use of health services and resources. We're beginning to see a change in healthcare for the better in regards to the transgender society. Clinic on Portage has a whole department dedicated to transgender needs. Manitoba Health covers part of the surgical costs for transgender reassignment surgery, which Dustin is currently in the middle of right now. There is Dustin in front of the clinic in Montreal, which is where he will end up having all of his upcoming surgeries, which we start next year. And on February 1st of this year, you don't need to read all of that. I'll tell you the basics. The government changed the law regarding a person's gender marker. This new legislation now states that a person can change their marker without having to go through the full surgical procedures, as it's actually pretty common to identify as transgender, but not actually physically change your body. So there's many people that might identify as a different gender than they were assigned at birth and never go through the surgical procedures, but their ID will always say what they're assigned at birth, until now. In this article, it was stated that having a sex marker on one's identification that is mismatched with one's appearance regularly puts transgender people at risk of mistreatment. This process is a key step in supporting the safety of transgender individuals. Individuals still have to seek out healthcare and find good advocates, usually a doctor that knows them well, to sign off on their sureness of their decision, which is what Dustin's experiencing. While we no longer have to go through all the full surgical procedures with him to get his gender marker changed, he still has to have a doctor sign off based on psychological assessments that deem that he identifies as a male. So he still has to go get a signature from somebody else to do that, but we no longer have to go through the surgeries to acquire that gender marker change. So it's a really big step, and I'm really happy that Dustin and I get to go and make that final ID change this year. While we hope that discriminatory practitioners are a small minority of today's healthcare providers, it is still important to address overt discrimination in the system. Those who cannot or will not unlearn negative beliefs or attitudes should be encouraged to seek out training, like the training offered at Rainbow Resource Center, which specifically goes through a lot of the things that Jennifer was talking, a lot about terminology and how best to support people, or request work placement in a situation in which they can better support others. This means making available in every community the names of healthcare providers who are able and willing to provide affirmative services. Providers can be discriminatory without intent. What counts most in identifying discriminatory practices is how practices are perceived by the queer patient or client. Queer patients or clients are healthcare providers' best teachers with respect to identifying discrimination against them. I have personally watched Dustin teach everyone around him, doctors, nurses, and staff, everything they could possibly want to know about being transgender. Creating an atmosphere of openness in which supported individuals are encouraged to tell support staff and practitioners when they are experiencing harm can do much to bring awareness to practice. In closing, what we need to remember here is this: if we are choosing to be in a role of a caregiver, support staff, educator, or community resource, we should be giving the supports that are applicable to the individual's needs. In my experience with Dustin, he is a great teacher and a great self-advocate, but I can always strive to work harder to be more knowledgeable and more inclusive to his experience. That's all I have.
So before we wrap up for today, does anyone have any questions for either April or Dustin? Oh.
I know you may or may not have a point of reference for this, but do you think because you're perceived as having a disability, it's been harder for you than people in the community at large to get the help you need and get the support you need from the medical system?
I mean, I don't find it as complex.
Okay.
It might be a little bit easier in the fact that despite the fact of any even non-perceived disability, the fact that he also has strong advocates, so he's not entirely on his own. If he was on his own, that might make it more difficult for him, but having strong advocates is a huge part of it, which is exactly what we're talking about, that we need to be strong advocates for people, especially the people that we're supporting that have disabilities, but then even more inclusive of people that exist under this umbrella because they're dealing with multiple stigmas.
Because it's such a fight to get any kind of health care for a lot of our folks because they have a disability. Doctors often aren't as helpful as they could be, and they don't always listen to us as advocates because they perceive themselves as the experts. And I'm just wondering, and I think you're right, I think you've been a really good advocate for Dustin as well as him being a good advocate for himself. But that's not the picture for some of our folks that are less verbal, less capable, and less confident.
Mm-hmm.
So we'll use him as an advocate when other people have problems.
Sorry, was that another question?
As, we'll call on Dustin when we really need advocacy.
Sounds like a great idea. Excellent. Any other questions?
Good. Thank you for your story. I appreciate it very much. Sharing this. That takes. April, I'm here from the United States. I'll be presenting tomorrow, and I just got to tell you, man, the code of ethics that directs what professionals need to follow. There's 9 tenets of the code of ethics, and as you were telling your story about supporting Dustin, you hit every one completely.
Thanks.
I don't know if you knew you did that. But you're the example of what an ethical direct support professional needs to be in this world. So good work.
Thank you.
Dustin.
And while April blushes a little bit, any other questions for either Dustin or April? All right. So first, I just want to thank you for joining us for our session today on starting conversations. I hope you've learned something that you can take back in your everyday life. And so we do have our afternoon keynote speaker, which will be starting shortly in the Centennial Ballroom, the room where everyone had lunch. And also, just as a note, after today, you will be receiving an email with a survey on how you felt your sessions went today. Please do fill that out. We do rely on that feedback to make the CCDA better. And especially because this is our first year at the Victoria Inn, we'd definitely like that feedback. Thank you very much for joining us, and have a great day.